Most people know that diabetes has something to do with insulin. People with type 1 diabetes, which French people call thin diabetes, have a problem with their pancreas. Their pancreas is no longer making enough insulin to keep them alive. As a result, they need to take insulin shots for the rest of their life. On the other hand, people with type 2 diabetes, which French people call fat diabetes, are naturally thin people. Their body is resisting the effects of insulin in order to keep them from storing any more fat from their diet in their fat cells. As a result, they can end up with abnormally large amounts of insulin in their system. This high level of insulin in the system can end up causing problems with the sex hormones. In this video, I will explain how problems with insulin relate to problems with the sex hormones and how the pregnancy hormones can end up causing problems with blood sugar. The sex hormones affect appearance, sex drive, and fertility. The female hormones make you look more feminine, and the male hormones make you look more masculine. Men and women have both male and female hormones in their body. Women are supposed to have more of a balance toward the female hormones, and the men generally have more male hormones than female hormones in their body. On the other hand, if you see a woman who's growing a beard, you might suspect that she has a little bit too much male hormone in her body, and you're generally right. When women grow beards, it usually means that they've got a problem with their male hormones, but it can also mean that they're having a problem with insulin. When women have facial hair and body hair in patterns that look like a typical male pattern, the condition is called hirsutism. By the 1920s, French doctors understood that bearded women often suffered from high blood sugar because of insulin resistance. Many bearded women are overweight. Now, many of the people who worked as bearded ladies in circuses and carnivals were actually women who were wearing a wig on their face or were men in dresses, and these performers tended to be slim. But today, when you see a woman who's having a lot of facial hair, she tends to be at least a little bit overweight. That's because she's probably suffering from a condition called polycystic ovary syndrome. A polycystic ovary is filled with lots of tiny sacs of fluid that represent failures of ovulation. Every baby girl is born with all of the egg cells that her body will ever produce, or that her ovaries will ever produce. From the time that she's born, the follicles are mainly in this primitive state called primordial follicles. Each of these follicles contains a potential egg cell. After puberty, when she starts ovulating, every month a few of these primordial follicles will be recruited and start to develop. As they develop, one of them will get a head start on the others, and then it will start to produce estrogen, which suppresses the development of the others. So as a result, you usually end up with just one follicle developing to the point of ovulation in any given cycle. Now, sometimes you can end up with two or more follicles developing and ovulating, and especially if you're taking fertility drugs, then you can end up with releasing a lot of eggs in a single menstrual cycle. So as the follicle grows and develops, then it eventually gets to the point where it bursts and releases the egg cell, which can then go on to be fertilized. However, when you have polycystic ovary syndrome, because of the hormonal balance being wrong, the cyst will be the follicle will be arrested at this stage of development and will not burst. So as a result, the ovary will be full of these little sacs of fluid. Because this development of the follicles is arrested, the women with PCOS seldom ovulate. And as a result, it can take them a long time to become pregnant if they're trying to become pregnant. But when you look at their ovaries through an ultrasound examination or look at them during surgery or at autopsy or what have you, you can see that their ovaries are filled with these little bags of fluid. Many symptoms can occur in women who have these polycystic ovaries. One of them is high blood sugar. Sometimes they can even have type 2 diabetes, but sometimes they just have mildly elevated blood sugar, which is called prediabetes. And sometimes their blood sugar control is still pretty normal, but their insulin level is still high. Often, because they do not ovulate every month, they miss periods and have problems with fertility. However, if you have polycystic ovary syndrome, do not rely on it as a method of birth control, because you never know when you're going to ovulate. Women with polycystic ovary syndrome often have pain in the pelvic region. They also have excess hair on the face, chest, stomach, thumbs, or toes. They may have thinning hair on top of their head or may even have baldness. They tend to have acne, oily skin, and dandruff. And they often have patches of thickened, dark brown, or black skin, typically in skin folds, such as in creases on the neck or on the elbows and so forth. This problem is called acanthosis nigricans, and it's also a symptom of type 2 diabetes. It looks like that your skin is dirty and it's just not getting clean when you wash it. Because endocrinology is very complicated, the exact symptoms in a case of polycystic ovary syndrome can vary over time and can vary from person to person. This is because the hormones interact with each other, and they interact with the genes, which vary from person to person. There are also complicated pathways inside the cells that can alter the effects that a hormone would have on that cell. Also, some women naturally have more hair than others for genetic reasons. If a woman with PCOS does become pregnant, she's at risk for getting gestational diabetes. Now, the reason for this is that it's normal to have a little bit of insulin resistance during pregnancy, because this will help to support your blood sugar while you're fasting, so it will make sure that your blood sugar doesn't drop too low, so you will ensure a consistent flow of sugar through the placenta to the baby, or to the fetus. It's still a fetus as long as there's the flow through the placenta. So many women who have a little bit of insulin resistance anyway, when they become pregnant, that can push them into having really serious problems with their blood sugar, and that temporary case of diabetes during pregnancy is called gestational diabetes. Gestational diabetes is dangerous for the mother and the baby. Both PCOS and gestational diabetes are the result of eating a fatty diet. Fatty diets promote weight gain. If your body does not want to gain any more weight, it may start resisting the effects of insulin. That's because insulin not only affects your blood sugar, but it helps you store fat in your fat cells. And if you are a naturally thin person and your body does not want to gain any more weight, it will resist the effects of insulin in order to resist storing more fat. But if this insulin resistance becomes severe enough, your blood sugar will go up. Now, if your blood sugar goes up, your pancreas will start making extra insulin. As a result, you will have high blood sugar and high insulin levels. Now, this extra insulin can then cause an imbalance of your sex hormones. Now, the problem is too much fat in the diet, and the solution to this problem is to eat less fat and to switch to a diet that is mainly starch. We have known since the early 1930s that eating too much fat causes you to resist the effects of insulin. And the more carbohydrate you eat, the more sensitive your body becomes to the effects of insulin. Now, if you look at this graph here, this was actually done on a man, so it's not in a woman with PCOS, it's actually in a healthy man. And you can see that when this man, I think he was a medical student, was fed a high-fat diet for a week. This was 80% fat by calories. This is pretty much close to those ketogenic diets that you hear about nowadays. But at least it's a very Atkins type of diet. They fed this guy a high-fat diet for a week. Then they gave him a dose of glucose in water. And then they measured his blood sugar. And look at how high his blood sugar went up. My goodness. It went up to 200 milligrams per deciliter, which made him officially diabetic. And it eventually drifted off here. Now, same person was fed a starchy diet for a week. And then look what happened during the glucose tolerance test. Look, dose of glucose, and his blood sugar hardly budged. That's because the high starch diet, this starchy, high carbohydrate diet, had made his body very sensitive to the effects of insulin, which meant that the body knew how to control its blood sugar naturally. PCOS results from an imbalance of several different hormones. And it results from an imbalance of hormones from 3 different glands. Insulin from the pancreas, which controls blood sugar, estrogen from the ovary, and androgens, which are male hormones, from the ovaries and from the adrenal glands in women. Because of this hormonal imbalance, the woman may have few or no periods and may have trouble getting pregnant. A hormone is a chemical messenger that is made by cells in one organ and that is released into the bloodstream so that it can have effects on target cells in some other organ. One hormone, such as insulin, can have different effects on different tissues. And also the male hormones promote the growth of hair on the face, but can suppress the growth of hair on the scalp. So each cell is reading a different part of its genetic playbook that will tell it how to react when it comes into contact with a hormone. It can tell the cell whether to express a receptor for that hormone and what to do when that receptor is triggered by binding to that hormone. Hormones are made by endocrine glands. And the endocrine system includes the hypothalamus, which is part of the brain, which is up here. And underneath it is the pituitary gland, which is called the master gland of the body. And the pituitary gland sends signals to other of the endocrine organs, including the thyroid and the adrenal glands, and in women, the ovaries, and also in men, the testes. Of course, your endocrine glands are not the only source of hormones in your body. You can also get hormones from your food, especially if you eat food that comes from animals. Animals have practically the same hormones as human beings have. If you eat food that comes from animals, you get a dose of their hormones. Even organically produced animal source foods contain hormones. Dairy foods in particular are a huge source of estrogen, even if they are produced organically, because dairy cows are milked while they are pregnant. Hormone release in the body is controlled by a negative feedback loop. So if you have some signal in the hypothalamus decides, for example, that you're to go through puberty. It'll send message to the pituitary, and that message will be in the form of gonadotropin-releasing hormone. The gonadotropin-releasing hormone in the pituitary will tell the pituitary to release follicle-stimulating hormone and luteinizing hormone. Those hormones will then be carried by the bloodstream down to the ovary or the testis, and the ovary or the testis will release the sex hormones. Those sex hormones will then enter the bloodstream. They'll come back up here, and they will tell the hypothalamus that everything's fine, we've got enough hormone in the system, you don't have to keep producing the gonadotropin-releasing hormone. So it will suppress the gonadotropin-releasing hormone. So as when your ovaries are functioning, the hormones that they release tell the hypothalamus everything's fine, you don't have to keep stimulating the system. So this is what's called a negative feedback loop. The body has systems for suppressing the release of too much hormone, but it also has ways of getting rid of hormones that are in the body. One way is to break them down in the liver. The protein hormones, such as insulin, are largely broken down in the liver. And when they're broken down, they're pulled apart into the individual amino acids. The steroid hormones, in contrast, can be turned into conjugated forms that then become water soluble. So once they're water soluble, they can pass through the kidneys into the urine and out of the body with the urine. Some of the conjugated hormones can then be passed into the gallbladder with the bile, and then it'll pass into the small intestine, and eventually it'll make its way out through the body with the feces. Now, what can go wrong with this system is if you are not eating enough fiber. High fiber diets allow you to get rid of the hormones that your body is trying to excrete through the liver, because the fiber binds to these sex hormones and other things that your liver is trying to excrete. And the fiber also speeds up the flow of material through your gastrointestinal system so that you will have less of a chance to reabsorb these things. So if you eat a high fiber diet, that fiber will help to carry the excess hormone out of your system. So as a result, you can end up with lower hormone levels. Insulin is a protein hormone that is made in the pancreas in response to high blood sugar, and in particular to a sugar called glucose. Insulin is the hormone that tells cells all over the body how to respond to a meal. Insulin tells the cells in the liver to store a lot of the incoming sugar as glycogen. Glycogen is a starch that is made out of glucose. Insulin also tells the cells of the heart and the muscles to use as much sugar as they would like for energy. It also allows muscle cells to turn some of the glucose into glycogen as a storage form of energy. Insulin also tells fat cells to store fat, and insulin tells cells all over the body that they can use amino acids to make protein. So insulin has growth-promoting effects. Insulin also affects the balance of the sex hormones. If there's no insulin in your body, the ovaries cannot function normally. Of course, you would also die, but your ovaries also would not function normally. However, if you have too much insulin in your system, the ovaries will produce too much male and female sex hormones. The excess insulin that is produced in cases of insulin resistance also causes the liver to produce too little of a protein called sex hormone binding globulin. Because of the shortage of sex hormone binding globulin, the male hormones can have more of an effect on the body. So as a result of too much insulin, you end up with too much male hormone in the body. The standard treatments for polycystic ovary syndrome and the related infertility are generally to use a drug called metformin to override the insulin resistance. So if you no longer have that insulin resistance, then your hormones will normalize. That is the standard treatment for PCOS nowadays. Now, the hard way to deal with PCOS is to lose weight by eating less and exercising more. If you lose weight by this method, if you lose weight even by eating an unhealthy diet, you will take away that pressure of overnutrition, and as a result, your body will not be as resistant to insulin. So as a result, you'll get better control of your blood sugar. So even if you lose weight from a diet that's not good for you in general, you can get better control of your blood sugar. Now, the best way to control your blood sugar and to manage things like PCOS is to switch to a low-fat, plant-based diet or vegan diet, which will promote weight loss and improve your insulin sensitivity naturally. As I mentioned, PCOS is a common cause of infertility. Because the woman rarely ovulates, it takes a long time for her to become pregnant. And because of this fertility problem, many women resort to expensive and potentially dangerous fertility treatments such as hormones to promote ovulation. But it is better to correct the PCOS naturally by correcting the diet, because it's best for the woman to have normal sugar metabolism from the very start of her pregnancy. A little bit of insulin resistance is normal during pregnancy. Pregnancy hormones cause a little bit of insulin resistance. This insulin resistance helps to keep the blood sugar from dropping too low between meals. As a result, the fetus can get a steady supply of sugar. But too much insulin resistance during pregnancy causes gestational diabetes. The excess sugar can damage tissues throughout the woman's body. It can also overfeed the fetus. As a result, the fetus can grow to be abnormally large, which is called macrosomatia. As a result, the mother and the baby are at risk of birth defects and birth complications. Gestational diabetes is dangerous for mother and baby. Gestational diabetes can lead to premature birth, and it can lead to problems during delivery. A large fetus is very hard to deliver vaginally. If you try to deliver a fetus that is very large, the fetus's shoulder can get stuck on your pelvis during the delivery. And often when they try to pull this baby out and try to free the shoulder, they can end up damaging the nerve that serves the arm, and you can end up with a form of paralysis called Erb's palsy. Babies who were born to mothers who had gestational diabetes during pregnancy can be born with breathing problems, blood sugar problems, and jaundice. Our rich fatty diet is causing problems for women, and these problems include polycystic ovary syndrome, infertility, gestational diabetes, heart disease, type 2 diabetes, stroke, and a higher risk of cancer and autoimmune disease. The solution to the problem of fat diabetes or polycystic ovary syndrome or gestational diabetes is to eat a diet that is high in carbohydrates and very low in fats. And this kind of diet is also good for people with type 1 diabetes because it improves their sensitivity to insulin. Women do not need to eat meat, milk, eggs, or fish, not even when they're pregnant. The ordinary plant-based foods provide all of the essential nutrients except for vitamin D, which is called the sunshine vitamin because you get your supply of vitamin D from having sunlight on your skin, and vitamin B12, which comes from bacteria. Now, a lot of people are saying, oh, well, pregnant women need to eat fish or take fish oil. No, they don't. Omega-3 supplements for a pregnant or breastfeeding woman do not seem to provide benefits to the baby. And fishy diets and fish oil can cause the pregnancy to last a few days too long. Human beings should get the bulk of their calories from starchy foods such as grains and starchy vegetables such as potatoes or pumpkins, and also from beans, which contain starches. If you want to know more about diabetes and about polycystic ovary syndrome and gestational diabetes, see my book Thin Diabetes, Fat Diabetes, or go to my website thindiabetes.com. If you are sick, or if you have any questions about what you should be eating, you should talk to a registered dietitian who works with your healthcare provider. If you have any prescription medications or any health problems, talk to your healthcare provider before you make any major change in diet. For more information about plant-based nutrition, go to Dr. McDougall's website, drmcdougall.com, or the Physicians Committee for Responsible Medicine, pcrm.org.